Well, we've got an NHS that's being completely starved of cash, an NHS that is in no way overspent, an NHS that's simply catastrophically underfunded. Locally, it's actually even worse than it is nationally, because what we've got locally is above average health needs. In Shropshire, we've got an older population. In Telford and Wrekin, we've got a relatively socially deprived population. That means in both parts of our patch, we've got above average health need. We should therefore get above average health funding. We don't. We get rock bottom NHS funding. We get the 6th lowest level of NHS funding in the entire country, which is an absolute nonsense. If we got the average, we'd have in Shropshire, Telford and Wrekin, we'd have another £82 million a year. If we got the same as Cornwall, which you might think has a similar demographic to Shropshire, we'd have another £181 million a year. So we're being done over. This is real data. This is NHS England data. We contacted all our local MPs to tell them about this and see if they could take it up with the government. Out of the 5 of them, only 1 actually had the courtesy to reply. The others don't want to know. I don't think that's good enough. We've got the NHS nationally on a complete knife edge, and here, locally, if we don't sort out more money for Shropshire, Telford and Wrekin, our local NHS will fall apart. That's already starting to happen, and it's set to get much, much worse. So that's what's happening with money. On betrayal, I mean, it was fascinating, wasn't it, listening to Simon Wright? Because you listen to Simon and you think, oh, everything's fine and dandy. It's absolute routine, isn't it, for district general hospitals to close their neurology department for 6 months. I mean, it happens all the time, nothing odd about that at all. You know, if you can't get treatment for your motor neurone disease or your brain tumour or your multiple sclerosis, well, I mean, it's like that everywhere, isn't it? Don't need to worry about that. It's routine also to close your ophthalmology department for 6 months. Again, happens all the time. Shame if you've got glaucoma, shame if you've got macular degeneration, but never mind, don't worry about it. They really, really care, you know. Well, I mean, I sat in the Joint Council Committee meeting where the absolute bombshell of the local crisis in service provision first became public. And I'll tell you, the councillors had no idea of the level of crisis in our local hospitals, and they were furious about it. And one of the people in that meeting said something along the lines of, well, now we're finding out about this. I wonder what else is going on that they're not bothering to tell us about. Genuine anger from those people. And I was also in the board of SATH, the two hospitals, the board meeting Thursday of last week. And you know, it felt very different to what Simon was saying tonight, very, very different indeed, because with a couple of honourable exceptions from board members, most of the members there didn't seem to think that the collapse of local services was a problem at all. They talked about whether or not they wanted to offer those services long term, and they talked about whether or not they were going to lose money by not offering those services. What they did not make was a commitment to patients who desperately need to have access to that care locally. Patient care was not part of their agenda at all. Simon Wright said at that meeting, he said, this is about solving a problem, not creating a crisis. Well, no, because this is about ignoring a crisis that is already there, and it shows frightening disregard for patients who are suffering the consequences of that crisis. It was a shocking meeting, and one that for me was a meeting where SATH absolutely crossed a line in terms of displaying utter contempt for local people. The NHS staff survey results came out very recently. SATH, our hospital trust, is in the lowest 20% nationally for staff who think that patient care is the organisation's top priority. Well, I wonder why. We've also got, locally, we've got an emergency service that's failing. One very quick anecdote, there are plenty of others, but I was told recently about a very elderly lady in her 90s. This incident happened in early March. An elderly lady with dementia, she had a fall. She got a head injury as a result of that. She was taken to A&E at Shrewsbury. She arrived at about 3:30 in the morning. There was no capacity at Shrewsbury A&E, so she waited on trolley for hours and hours and hours. She was seen by a doctor in the afternoon. The doctor wanted to admit, guess what? There were no beds, so it was back to the trolley and waiting again. And this very confused, very distressed, elderly lady with dementia arriving at Shrewsbury Hospital at 3:30 in the morning was given a bed at 4:30 the following morning. 25 hours for this woman to access basic care. This is an absolute disgrace. And if this is how we treat the most vulnerable members of our society, we are failing and failing catastrophically badly. Simon Wright knows those things are happening. Why doesn't he feel the same anger about that most of us in this room will feel? What I want to stress is this is absolutely not the fault of staff. They are doing a heroic and magnificent job under failing circumstances. This is a system that is letting down patients and letting down staff. 2 hospitals with insufficient A&E capacity, insufficient beds. SAF, the organisation that Simon Wright is in charge of, has declared high escalation levels. That's an official red alert, 32 times so far this week. There are human beings behind those numbers. And you want to know their solution? Well, short term, it's close down the A&E at Telford overnight, ferry patients around the country, around the county by ambulance, leave less capacity. The research evidence is clear, longer ambulance journeys to get emergency care, kill people. It's outrageous. It is genuinely outrageous. The longer term plan as well, close one of the A&Es completely. Simon denied that. Why deny it? It's public knowledge. Downgrade one of the hospitals, cut 30% of care out of hospitals and hope that the community can somehow pick it up without the money to pay for it. Again, dangerous nonsense. Keith touched on STPs, Sustainability and Transformation Plans. Well, our local STP is about cutting £135 million every single year out of NHS spending in Shropshire, Telford and Wrekin. And it gets worse than that because it's also about axing about 2,000 NHS jobs locally. That's an absolute jobs massacre. The impact of that on local services will be an absolute disaster. Some very quick headlines out of our STP, our local plans. £10 million cuts to hip and knee replacements in Shropshire. A terrible attack on older people. Unnecessary pain and disability arising out of that. Community hospitals facing cuts of £3.8 million a year. That's one hospital, possibly 2 hospitals, taken out altogether, according to a GP I've spoken to. A review of community hospital inpatient beds going on now. A review of minor injuries units going on now. Both of those reviews about saving money. A near obsessive desire to close down or downgrade the rural maternity units in Oswestry, Ludlow and Bridge North, again to save money and for no other reason. Shocking attacks on all of us. And there's this little game being played. It's called neighbourhoods, or occasionally called community resilience. And the game is that when they cut the £135 million and the 2,000 jobs, and there's a shortfall in social care as well it'll all be okay because we can all of us play at being doctors and nurses and psychologists and social workers and so on, and it will all be absolutely fine. Well, no, it will not be fine because we do not have the skills to do that, and real people will be harmed by this to an absolutely monstrous extent. I know all this sounds very bleak, and it is very bleak, but it's not the whole picture, and I'll wind up in 2 minutes on this. The other side of the picture is that we're angry and we're organised and we're fighting back, and we're also united, and that's important because we don't play the Wales versus England game, and we don't play the Telford and Wrekin versus Shropshire game, because what we demand is decent healthcare for all of us, wherever we live. We need you as part of Shropshire, Telford and Wrekin Defend our NHS. We need you actively campaigning to save the NHS. We've had victories. We've held off A&E closure so far. We've got stroke rehab brought back to Shrewsbury. We've stopped Ludlow Maternity Unit being closed down last autumn. We've stopped Oswestry and Bridge North maternity units being downgraded. We stopped last summer, I'm so proud of this, £670,000 worth of cuts for frail elderly people and people with mental health problems. We've done incredibly well. We have to also do more. It's tougher because the cuts are deeper, the attacks are harder, and because this is our corner of a national attack on the NHS, we also have to get political, not party political, because we're a broad-based campaign and we have to stand together in defence of the NHS. But our MPs are letting us down very, very badly indeed, playing the our A&E versus your A&E stupid game and failing miserably to fight for the funding that the NHS needs. That's not good enough. We also need our local council, Shropshire Council in particular, to be far, far more proactive and far more high profile in challenging the attacks. In terms of what's happening now, this is for real. It's crunch time for the NHS. 2017 is crunch time. We all need the NHS. We need the biggest, strongest, broadest, most united fight we can get to save it. Make sure you've left your contact details, including your email address or your phone number with us before you leave. Join the fight back. Let's keep the NHS all of us need.